Okay, so prior to entering the room, I would have checked the patient chart and made sure that the doctor ordered a urinary catheter insertion. I would have prepped all of my equipment, made sure I got it and was ready. I would have entered the room, provided patient privacy, introduced myself, 2 patient identifiers, checked allergies to latex, iodine, betadine, or shellfish. I would have performed perineal cleaning as it was needed and made sure that the insertion site was good, found the urethra. Okay, so now I'm going to lift the bed. Alright, I'm just going to expose you while I prepare my sterile field. Alright. Hand hygiene. Okay. So pull this out of the box. There. Okay. So sides and the front. Gloves away from me. Swivel this, making sure not to touch the outer edge. I'm going to take this. I'm going to drape it between the patient's legs. In real life, I would have had her put her heels together with her legs apart so that area would be flat. It's a little not functioning right now. So I'm going to separate these 2 parts. These out and have them set there. This goes in the garbage. Okay, then I would take my syringe and hook it up to my little port here. Then I'm going to take the lube, which in the clinical setting I would have opened the lube and put it on my tray, and I would have left the tip of my catheter lying in it, but since we don't have that luxury, I'm going to take this around, make sure I get enough on there. That's set there. Put that back. Okay. Now I'm going to swab the perineal area. So this hand's going to be my dirty hand. I'm going to separate the labia and clean on one side. Clean on the other side, and then clean down the middle. Alright, now I'm going to move my box over here. In the clinical setting, her legs would have been spread apart as far as possible, so this would be on a flat surface. Alright, so Mrs. Smith, I'm going to have you, when I count to 3, I'm going to have you take a deep breath and bear down for me. So 1, 2, 3, bear down. Making sure I'm not touching the vagina with my clean hands. That wouldn't be happening in a clinical setting. go until I see a flush of urine, and go in about 1 to 2 more inches. And then I would inflate the balloon, only about 5 milliliters, or as the urinary catheter calls for. And then I would tug on it until I feel some resistance. I don't want to wreck this. Okay. Tug until I feel some resistance. And then I would take this out of the package. This can go back up here. And I would attach it to her leg, giving her some slack. Oh, this would have been detached after I filled the balloon. And then I would attach this to her leg, and then hook this to a part of the bed that didn't move. I would assess the color consistency, just what the urine looks like, how much there is of it, if there's blood or anything floating around in it. So I'd hook that to the bed somewhere. We'll just put that there. Take my gloves off. And dispose of them as properly. And then I would clean the perineal area and just get things cleaned up. Ask the patient if they have any questions or concerns and address those. And then put this down and cover her back up. Give her her collet. Put the bed in lowest position. Perform hand hygiene. Leave and document that the urinary catheter was inserted. For the removal, I would check the patient's chart to make sure that the doctor has ordered the removal of the catheter. I would get my supplies ready. I would enter the room, provide patient privacy, introduce myself, patient identifiers, ask if they have any allergies or any questions, describe the procedure for the patient, and let's get started. So put that up. This is in here. Okay, so I'm going to expose you. Lift this up, check around, perform hand hygiene. Check around the urinary catheter. Is there any redness or irritation or discharge? Let's see. If there's anything extra I need to do. Oh, clean the perineal area if there is any discharge or anything like that. Oops. I would perform hand hygiene, put gloves on. Alright, put some gloves on, and then that would not have happened. I don't know if that's important, but alright, so I would deflate the balloon, make sure all the water that I put in comes back out, dispose of that. Alright, while I take this out, you're going to feel a little bit of burning or a little bit of discomfort. On the count of 3, I'm going to have you take a deep breath and bear it down. So 1, 2, 3. Pulled out. I'm going to check the tip to see if it's intact. If there's any blood on it. Before I took the catheter out, I would have emptied the bag and checked the urine to make sure it was clear and there wasn't any blood or, I guess, discharge in it. So I would take that off, dispose of it properly, dispose of my glove, perform hand hygiene, put new gloves on, clean the perineal area, dispose of this in the linens, the dirty linens basket. All right, check to see if there's any irritation or anything like that. Cover the patient back up. All right, Mrs. Smith, so you're gonna feel some burning or some discomfort the first couple of times that you use the restroom. And that's completely normal. The first time you use the restroom, just give us a buzz on your call light and we'll come and check the volume and color and consistency to make sure that everything's looking good. If the burning and discomfort continues after a couple of days, I'll let your physician know and we'll do some assessments from there. Do you have any questions or concerns? No? Okay, looks like we're good. So put the bed in the lowest position. Give her the call light, perform hand hygiene, make sure everything's good, clean up anything that I have lying around, pick up my equipment, and perform patient privacy and leave.